Hello, I am Commissioner Emma I. Darnell, and welcome to Mighty Five Conversations. Conversations is a monthly information and communication program focusing on the sustainable community, economically strong, environmentally safe, with liberty and justice for all. Thank you for joining us. I will be back in a moment. Joining me in the conversation today is Vincent Vandiegriff. Mr. Vandiegriff is the director of the Fulton Asthma Improvement and Reduction Project, FAIR, a community-based asthma education and prevention program. Mr. Vandiegriff is also the executive director of Learn to Grow Incorporated, Health, Education, Awareness, and Research on Tobacco Heart Coalition. Welcome, Mr. Vandiegriff.
Thank you very much.
Well, school is back and asthma with it.
That's right.
And we want to talk about asthma today.
Okay.
A little bit from the standpoint of what is it and why is it? We were very concerned to learn recently from FAIR that in a survey of the 100 largest metropolitan areas in the United States, Atlanta, Fulton County's largest city, was ranked number 24 among 100 cities that were considered asthma capitals.
Right.
The most challenging places to live with asthma.
Absolutely.
We knew we had an asthma problem, but we didn't know it was worse than New York City and Las Vegas, Nevada.
Right.
Also, I guess more importantly, Mr. Vandiegriff, your organization also pointed out to us that some of the risk factors that they used to rank cities were well known to us, such as air quality and pollen count, that sort of thing. But there were some other factors that you and public health officials brought to our attention, which frankly came somewhat as a surprise.
Okay.
We want to talk about some of those risk factors today.
Yes.
Because you told us that you don't necessarily grow out of asthma.
Right.
You can die from asthma.
You can die from asthma. That is correct.
So let's talk about prevention and talk about some of these risk factors, because you don't have to die.
You don't have to die.
And you don't have to go to ER like most children do.
Right.
Packed with ER over there at Grady.
Exactly.
So, Mr. Vandiegriff, tell us a little something about those risk factors, because if we know the risk factors, we can reduce them, can't we?
We can. Let me start off by saying thank you for allowing me to come today. Asthma is a chronic disease.
Chronic, isn't it?
It's very chronic. And we know that secondhand smoke is one of the number one triggers for asthma. That's how we arrived at this point. We also gauge those factors that you just mentioned.
Secondhand smoke.
Secondhand smoke.
You don't have to smoke yourself.
You don't have to smoke yourself. You can be around people that smoke and get the same effects. And that is dangerous. In fact, the 2006 and the 2010 United States Surgeon General's report indicated that there were no, I repeat, no safe risk levels exposure to secondhand smoke. That's serious.
When it comes to asthma,
Mm-hmm.
what are, in addition to secondhand smoke,
Mm-hmm.
what were some of the other factors that were listed that the association used in ranking these cities? They had something on there about poverty.
Poverty.
What does income have to do with a
Okay.
lung
Okay. Usually
disorder?
in inner cities, you find a lot of our residents living in substandard housing. Up until a certain year, homes were built with substandard materials, and some of those materials can trigger asthma. We know that some of our citizens live in high density areas, close to expressways and this kind of thing, and that can help
Airports,
airports,
landfills,
expressways, landfills, these kinds of things.
truck stops.
Exactly, exactly. They can help to exacerbate your asthma attacks.
I thought that you could deal with asthma by, you know, uh, investigating your home and making sure you didn't have dust. And are you suggesting that some of the factors that trigger asthma are outside the house?
That's exactly what I'm saying. Let me go a little bit further. In the FAIR program, we are going into the homes and assessing the homes for asthma triggers.
You definitely have to assess that house, don't you?
We're doing that, and we are finding that rat and roach droppings are asthma triggers,
Roaches,
dust mites,
dust mites.
these kinds of things. Let's don't forget secondhand smoke. Now these are what we call indoor environments,
I see.
but we also know that there are outdoor environments that contribute to asthma as well.
And what are those? Some of those,
Well,
in addition to the ones that you've named.
you look at what about fumes from a bus?
Bus fumes.
Bus fumes and these kinds of things. Uh, Another thing that we found out in terms of going into the home, Commissioner, is that a lot of our citizens don't know what their triggers are. That's important, because if you knew what your triggers were, then you could help manage them better. We also have found that a lot of our citizens don't know how to use their medications. That's an issue. But another issue I think that's overarching is that a lot of our citizens cannot afford their asthma medications. That is serious.
I noticed that was one of the risk factors that they used
Right,
in ranking cities.
right.
They used affordable access to
Exactly.
affordable health care.
Exactly, exactly.
They were referring to whether or not you can afford the medicine,
The medicine.
medication.
Exactly. And remember now, a lot of our citizens are uninsured.
They use that as a factor too, I noticed.
Right.
In ranking cities.
Exactly, exactly.
They use uninsured. Tell us more
Well,
about
if you're uninsured, then that means that you have to go to Grady, and Grady is I'm gonna say the world's best hospitals. Don't get me wrong, and they help all of our citizens in Fulton County, but they have to help more because of a lot of our citizens a lot of our citizens are uninsured because a lot of our citizens are unemployed. We call that a community condition.
These are recent
Absolutely.
recent situations too.
Absolutely.
Folks who could afford their medicine.
Right. Now they can't.
Back in '05, they can't afford it now.
They can't. Look, they have to decide whether or not they're going to try to put some food on the table or try to buy their medications. And I was just at a health asthma education workshop just last week at College Park when a couple of the attendees got up and said, "Hey, how can we get some affordable medications?" And that struck me kind of to the bone and everything, because we need to be able to do more for
We've
our
been going around checking to see what was in the dust in the house.
right.
And we hadn't paid too much attention to whether or not people could afford their medicine.
That's right, and that's huge.
Is that the link back to poverty? Is that why they have poverty? Poverty rate?
Poverty rate looks at housing, it looks at affordable health care, it looks at a host of things.
It looks at income.
Of
That's
course.
what poverty rate is.
Of course. If you can't afford it, then you can't buy it.
Yeah.
I run into a whole lot of people all of the time that have to make a choice, as to whether or not they're going to try to pay rent or try to get some groceries or try to afford this extremely high asthma medication.
They're trying to choose between food and medicine too, Mr. Vincent.
This is what I'm saying.
Our human services people see that every day.
This is what I'm saying.
Particularly among the elderly poor.
Absolutely.
They eat one meal a day, which they get at the centers.
I understand.
And so it's that external factor, isn't it?
Right. Right.
So as we talk about the management of asthma and triggers, we have to go outside the home sometime, don't we?
We have to go outside of the home.
Look at some of these economic social
indicators.
issues.
Exactly. And we also must look at trying to educate the community.
I want to talk about that. They've given me a signal for the break now,
Okay,
so we're going to talk about that when we come back.
All right.
Thank you so much for joining us. We'll be back in a moment. Mr. Vandiegriff, we were about to get down to the business of how we approach this matter of dealing with asthma. We have many elements of the community in Fulton County working under the umbrella of the Fulton County Department of Health Services that have come together, including your organization, which is a partner with us, to help us deal with this problem, which is a major problem.
It's a major problem
in certain sections of the county.
Right.
District 5, for an example, has one of the highest death rates of asthma mortality in the county.
Exactly.
So we have committed, the Board of Commissioners has committed resources to dealing with this and other major diseases, which are also disparities.
Right.
There are disparities among the population. Your approach is one we want to talk about.
Okay.
We noticed that you have committed major resources in partnership with Fulton County in going into the community, holding workshops with folks who may not have asthma. What is the rationale behind that? Going into a community and saying, you know, we're going to conduct an education workshop on asthma. Of course, we know there are certain requirements for the asthma management sessions, but why aren't we just targeting folks who have an asthma emergency, like send them over to Grady to the emergency room, or why aren't we just doing the internal inspections? Why are we going out, as you were in District 5 2 weeks ago, at the Adamsville Health Center, after hours?
That's right.
When people got off of work and came.
That's right. We do that, ma'am, because we are approaching asthma from a community level change perspective.
I see.
We understand that a lot of our citizens, suffer with asthma. We also know that we cannot get to each individual home. So what we want to do is, and what we're actually doing is, we see ourselves as a conduit connecting the community with the resources that they need.
That's so important.
Absolutely.
Folks don't know, do they?
They don't know. One of the things that we are doing is we want to mount an educational campaign to bring a spotlight to asthma. Doing our focus groups, and this is very important. Doing our focus groups, when I was out trying to gauge community readiness and trying to see just where the community is as it relates to asthma, one thing that I heard most often was that, well, asthma is so common. That frightened me.
Accept it.
Accept it. Because see, if it's common, that means you're not doing all that you can to address the issue. So what we have to do, and I'm very, 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 very adamant about this, we must educate our communities better about the dangers of asthma. We must educate them, and we must help to mobilize them to address the issues that they see in the community.
Many of them say that, I had asthma when I was a child, but I grew out of it. Do you find that we may underestimate the seriousness of asthma?
I think we grossly underestimate it, ma'am. I've heard the term, yeah, I grew out of asthma, but I've also seen people that have had asthma from the time they were born until they died.
Of course.
So, I don't think that is just, a catch-all that, that everyone does that. I think it depends on the individual. I also believe it depends on where you're living, your living standards, your access to medications, and your knowledge of your triggers and how to address those.
Uh-oh, we coming to the main thing we always get back to.
Education.
Knowledge,
Right.
education.
Right.
Without the knowledge, there can be no prevention, can it?
No. I always say this, and this is not being disrespectful, but you only know what you know. So what I have found in going into the homes and in talking to people in the community is that, they don't know how to use their medications.
If they can afford
If
it.
they can afford them. And also that I got to go back to when you see asthma as common, then you
Yes.
don't do as much as you possibly can.
You don't have any hope.
It's just something I got to deal with.
And every now and then I'm gonna have to go to emergency.
And that's just my
just
way
a
of
part
life.
of it.
That's just my way of life.
We got to deal with that, haven't we?
We can deal with
because
that.
that's not true, is it?
No, ma'am, that is not true. The more education we can get out to our community, the better off we all are. The better off we all are.
I noticed in this survey, in some of the material that you all prepared for us, that the number of hospitalizations for asthma, that's a mark against you. That's a mark against the city. The number of children that are over an ER.
That's right.
With asthma attack. That's maybe one of the reasons why we are lower than Las Vegas or New York. I don't know, but all I know, it was one of the factors that they looked at.
Let me touch on that. In working with the Fulton County Health Department, we looked at the data given to us by Grady Hospital. They indicated that ages 4 to 16
4 to 16
had the greatest amount of ER visits related to asthma. And Commissioner, I got to tell you, District 5 spiked.
Oh yeah.
The Mighty 5 has some of the most asthma visits, asthma-related visits
We're
in
number
the ER.
one.
Yes, ma'am. Yes, ma'am.
We are ahead of the so-called inner city district.
Yes, ma'am.
And it might go back to some of those external factors you were talking about earlier.
They have to.
We also have some more
We call those contributing
airports,
factors. Yes, right.
landfills, truck stops than you have in the inner city.
Expressways, a lot of our homes
Bus
and
fumes,
bus
too.
fumes, or a lot of our homes are situated near the expressways and these kinds of things. So there are a lot of contributing factors related to asthma. But I will tell you that I think that if we can educate our community enough to empower them, to let them know that they can do something about it from a community standpoint.
That's critical, isn't it?
Absolutely, absolutely. And they can also manage their asthma better with more education.
Give them the fish, give them the net.
And let them be a
They
fisherman.
catch their own fish.
That's it. That's it.
And that net is the knowledge.
The net is the knowledge. So
I like that community approach.
it's the community approach because, we don't have the kinds of funds and resources to go in each home.
Don't have it.
But we do have the resources and the knowledge to be able to put out the educational information that will reach the community.
And they will spread it.
And they will spread the word. Now, I'm not saying stop doing our
Got to
asthma
do it.
education sessions that we do in the community. In fact, we got a couple more scheduled for District 5.
Good. Tell us where and when.
We're going to go to the Adamsville Recreation Center. We want to do that this month. And we also want to go to Best Academy, Conley Elementary School, and Heritage Academy. Now, the reason I mention those locations, they have students and parents there. So we're going to be educating at the PTSA
That's a good
meetings.
place to start.
Absolutely, absolutely. Education,
With the schools.
absolutely.
Yes.
And those are the kinds of things that we are embarking on as we speak, along with an effective education campaign. I cannot overemphasize the fact that our people, our residents only know what they know. You put education out there on the internet. You know, we have an ability to create an app to where that go on these little cell phones and everything. You know, everybody on these cell phones these days, and you know, it's a way to get the information out to the people where they are. You had to go where the community is.
Tell us a little something about that secondhand smoke before we run out of time,
Okay.
Mr. Vandiegriff, because I was very interested to
Okay.
notice that in the evaluation of these 100 cities, they used as a risk factor 100% public laws.
Smoke-free
secondhand
laws.
smoking laws.
Smoke-free laws.
Yeah. Smoke-free laws.
Yes. Listen, our
We didn't
organization.
score well on
No, we
this
did not.
area didn't
No, we
score
did not.
well, yeah.
That is why, and I have to give my hats off to Councilwoman Shepherd
The outstanding leadership there.
and Councilman Wayne for bringing before the Atlanta City Council an ordinance to ban smoking in Atlanta parks. The Honorable Mayor Reed signed off on that on July the 25th.
They've given me another signal, Mr. Vandiegriff, but that is a good place if we got to stop.
Okay.
Is to stop there, because though we rank number 24 now out of 100 cities as being the most challenging places to live
Right.
with asthma, these smoke-free laws
Can
beginning
help.
with parks
Beginning with parks.
will help us.
Would not only help asthmatics, but citizens in general.
It's just
And
we've run out of time, though,
Okay,
Mr. Vandiegriff,
okay.
and I'm going to have to cut it off there.
Okay.
But I certainly want to have you back again,
All right.
and we will have you back again, because this is the kind of information that people want and need. They're not interested in speeches from politicians.
That's true.
They want to know, what kind of information do you have
That can
that's
help
going
them.
to impact me,
Right.
my children, and my grandchildren.
Absolutely.
Thank you so much, Mr.
Thank you.
Vandiegriff,
Thank
for
you.
all that you're doing,
Thank you.
working with Fulton County
Absolutely.
to help us manage this awful disease.
It's my pleasure, ma'am.
I'll be back in a moment with closing thoughts. Today, more than ever before, chronic disease prevention, like asthma, is considered by public health officials to be not only the key to healthy living, but also the most effective approach to the reduction and elimination of the high human and financial cost of today's broken health delivery system. If not us, who? If not now, when? That's all the time we have for today's conversation. We invite you to join us again next time. Stay strong. To learn more about today's conversation, contact me at 404-612-8222. That's 404-612-8222. You can also email me at emma.darnell@fultoncountyga.gov.